Let me now explain the 4 pillars in a little more detail. Primary care with care management promotes a community-based approach to providing medical services and meeting healthcare needs with a focus on reducing the risk factors for chronic non-communicable diseases and functional decline and increasing older persons' ability for self-care. This pillar also aims to enable more years of healthy and active aging through the provision of health promotion and preventative healthcare services, manages chronic diseases and their potential comorbidities, makes referrals for secondary and specialty care, and provides community-based follow-up. This pillar promotes longer years of active aging using a multidisciplinary team approach led by primary care providers. Community-based care providers make referrals to hospital and specialty care services when warranted and when the needs of patients exceed the provider's scope of practice. Primary care and care management also facilitates communication across levels of care by enhancing efficiency in the transmission of information, in making referrals, and in monitoring patient progress. Global evidence recognizes primary care physicians, nurse practitioners, and physician assistants as legitimate providers of care and as gatekeepers to specialty services. Nurses, including public health nurses and nurse practitioners, have been found to be highly effective in the role of caregivers and in facilitating connections and linkages to services and high-quality comprehensive care. Primary care with care management as a model of care has been linked to improved patient outcomes, cost-effectiveness, increased provider participation, consumer satisfaction, and direct access to data and accountability in healthcare settings. Integrated Services Coordination gives older adults, their families, and care providers seamless and efficient access to culturally responsive, appropriate home-based and community-based services. It offers a system of service delivery that promotes less restrictive care environments and limits stays in institutional settings. Integrated Services Coordination has been shown to decrease fragmentation in the healthcare system through networks that coordinate programs through a cost-effective and efficient approach. The Pillars framework includes a comprehensive electronic directory of community-based services and support systems. This system is envisioned to assist families and reduce caregivers' burdens by being responsive by facilitating the delivery of community-based programs and services to older persons in their homes or through other non-institutional settings. A common complaint by many older adults is that they are not aware of the services available to them that would allow them to live more active, engaged lives and to contribute more to their communities. Services such as transportation, homebound programs, social support with mental health, social services, alternative housing, rehabilitative services, pharmaceutical services, informal caregivers, and volunteer services have been shown to be cost-effective. These also are able to positively influence one's self-esteem, quality of life, physical, mental, and emotional health, and to extend the capacity of elderly persons to remain active with reasonable independence and self-care capability well into their maturing years. The electronic directory of services is envisioned to interface with the electronic transmission of patient needs, resulting in a recommended coordinated menu and schedule of services, private, public, and voluntary in nature, with consideration to the older person's personal circumstances and geographical proximity. Population-based health promotion and disease prevention is an aggregate-level approach to inform, educate, and empower groups of people about health through age-appropriate health education, health communication, and risk communication. The lifespan approach reflects the contribution of healthy lifestyle choices over time and throughout the stages of life. This approach correlates with delays and reversals in the onset of chronic diseases and other physical and mental challenges commonly associated with old age. To prepare older adults to more effectively delay, reverse, or adapt to physical and mental changes commonly associated with older age, this pillar promotes age-appropriate, culturally relevant health education, health communication, and risk communication using multiple approaches. The pillar advocates for the integration of health promotion into all sectors of society, including schools, the work environment, and faith-based organizations, amongst others. It also can support policy that mandates population-based health promotion and disease prevention. The final pillar, planning and accountability, facilitates an active process of community engagement through policies, regulations, and monitoring systems that are necessary to ensure safe, accessible, and healthy internal and external environments. Older adults with chronic diseases often have impaired physical abilities. Modifying the home and public environments to better accommodate the elderly's changes in mobility will greatly influence their quality of life and feeling of independence. Planning and accountability enables safe, well-lit sidewalks and walking spaces along streets, in parks, and other common spaces. It fosters surveillance to reduce violence towards the elderly, precautions regarding vehicular traffic, ease of access to public buildings and shopping, and other safeguards to allow older persons to engage with their environments, including opportunities for employment and volunteerism. Environmental policies, regulation, and compliance monitoring are necessary to ensure healthy environments for all society, especially older adults with limited mobility and complex needs. Moreover, this pillar amasses utilization and evaluation data for the entire pillar's framework or subsets of it, and its impact on the health and well-being of older persons, as well as its impact on workforce, economics, and other outcomes deemed relevant by governments. Because of the envisioned integrated database that underpins the framework, various types and levels of research would be possible given the presence of appropriate research protocols and strict enforceable guidelines for human protection. This pillar also has importance in collecting and analyzing data for use by policymakers and academic institutions in forecasting workforce needs. In summary, the Pillars framework is anticipated to contribute to more older persons living satisfying lives in their homes and in their communities for longer years of life, older adults having enhanced self-care capability, increased access to primary care providers, efficient access to a variety of community-based supportive and enabling services, reduction in perceived caregivers' burden, improved management of chronic non-communicable diseases among older persons, more efficient communication among primary, specialty, and institutional care providers, and overall cost saving for the care of older persons.